Hello everyone, welcome to Virtue Healthcare. Today we're going to be doing some self-care for our shoulder, mostly on the mat with our foam roller. But before we get to that, let's check out the anatomy. And here we are in complete anatomy, looking at the anatomy of the shoulder, all the muscle tissue that we're working with today in our rolling session. We're going to start with pecs. Pec major, attaching underneath the clavicle onto the sternum and into the connective tissue, crossing the shoulder underneath delt and bicep, attaching onto the humerus. Deltoid, continuing that attachment along the clavicle, along the acromion process here, and onto the spine of the scapula, attaching into the deltoid tubercle on the humerus. Next, we're going to look at pec minor. Pec minor underneath pec major, attaching into the ribs and into the coracoid process here of the scapula or the shoulder blade. And that lies underneath pec major. Biceps. Biceps attaching into the forearm, into the radius and the connective tissue, originating up at the shoulder, attaching into the top of the glenohumeral fossa and into the coracoid process. Go around to the backside to look at triceps. Triceps attaching into the olecranon, the elbow, and then into the humerus here and up underneath the glenohumeral fossa, just inferior to that, below on that lateral border of the scapula. Next, we're going to go to lats. Lats has a huge origin all the way up into the thoracic spine and down into the thoracolumbar fascia. A huge band of connective tissue, and then attaching into the sacrum and the iliac crest on your ilium or your hip bone here. Lats is going to wrap around the ribs and attach onto the front portion just underneath the lesser tubercle on the humerus here. You can kind of see it twisting here, which is kind of neat. And that's lats. Next, we're going to look at teres major. Teres major is attaching into the scapula, originating here at the inferior angle, and then wrapping around to the front. Very close attachment to lats here on the crest of the lesser tubercle here. Now we're getting into the rotator cuff. We have teres minor here. Teres minor staying on the back, just lateral and superior to the attachment of teres major, and then staying on the posterior side, attaching into the greater tubercle of the humerus, just on the back side there. Infraspinatus. Infraspinatus is taking up this whole area of the scapula underneath the spine. This is the spine of the scapula here. So attaching throughout this whole area and reaching out just above, running the same kind of line as teres minor, attaching onto the greater tubercle of the humerus here. Supraspinatus, the topmost muscle or superiormost muscle of the rotator cuff. You can see how it moves underneath in its orientation underneath the acromion process of the scapula. This is the acromion process here that comes out to attach to your collarbone. And then originates in the supraspinatus fossa, this kind of hollowing area of the scapula just above the spine. And the anterior or frontmost rotator cuff muscle is subscapularis. Subscapular fossa, or the whole underside of the scapula, so against your back, in between there, running laterally out towards the lesser tubercle of the humerus. Big internal rotator. You can get to this from the front with a ball, which we'll be working on when we work through pecs and through the front of the shoulder here. Lastly, we're going to go up into the neck, looking at traps. Trapezius is a huge origin all the way from the occiput, or the base of the skull, all the way down into the lower thoracic spine. That's its origin, and then reaching out onto the spine of the scapula, all the way around the acromion, and then onto your clavicle. You can see that it mirrors deltoid pretty much perfectly. In its attachment there. And then we have our neck muscles here. SCM, attaching from our clavicle and sternum and into the mastoid process of the temporal bone. Levator scapula, attaching on to the superior angle of the scapula and up into your cervical spine. A lot of people have a lot of tension here, holding your shoulders up. And then scalenes here, anterior, middle, and posterior scalenes, attaching onto your first and second rib, and then into your cervical spine. You can see how they kind of splay and attach onto different vertebrae. And that's it for the anatomy of the shoulder for now. Let's get back to the mat and do some rolling through the area. And welcome to the mat. Before we get started on working with the shoulder, let's check out a couple of tools. Probably something that most people are familiar with is just the standard size, full length, high density foam roller. This is awesome, and you can definitely do everything that we're doing today with this tool. It's easy to find, and it's very forgiving on the body. There's a lot of surface area, so it's not too specific with the pressure that it applies. So it's really great to use if you're just getting started, or in the beginning of your rolling session before you do some deeper work. We also have the trigger point therapy, kind of half-length foam roller, a little bit more dense because it is a hard plastic inside, but it's great for traveling. And almost last here, but not least, is some sort of ball, like a lacrosse ball type ball, something that is dense and is going to be able to do some really specific deep work. You won't use this everywhere, use it sparingly, but it is a great tool. This one is from Rad, and they make some amazing stuff. We'll have all this stuff linked in the description below. And the last one, and what I'm going to be using today, is the Orb. There's a few companies that make something like this, just a high density foam, very similar to the original, the first long full length foam roller. 5-inch diameter, it's like the perfect size. So that's that. When we're on the floor rolling, just work to your own needs. If anything feels just not right, too much discomfort, just back off a little bit. Have a yoga block around in case you need to support yourself in some way, Everybody has a different body, different tolerances, different injuries, different restrictions. So it's good to have around some supports for you as well. All right, we're gonna be getting into the shoulder. We're gonna start with the front of the shoulder first. We're gonna be starting by working through pecs, into delts, and then we're gonna work down through biceps. So let's get down on the mat. So here we're gonna be working around our sternum and working laterally. So just underneath the collarbone, out from the sternum, and we have this wide range of pecs here. We're gonna work out here. Work slowly to your depth. Just use your body weight and take your time. We wanna work millimeter by millimeter. I can't stress that enough. Our nervous system needs time to adapt here. So just get the ball just underneath your collarbone, just underneath the clavicle there, into pecs, and just let yourself slowly sink in. It doesn't look like I'm rolling the ball, but I am very slowly moving to my left to roll that ball out towards my shoulder here. Rolling is a connection, communication with our nervous system. So really have your mind in where you're rolling. What is your tissue telling you? What sensations are you getting? If you're feeling numbness or burning or shooting, electric, then you could be on a nerve or thumping on an artery. There shouldn't be any issues working through here, but in some areas that might be a little bit more common. So those are just things, sensations to look out for. You might feel a slight pinching or sharpness. That isn't necessarily bad. Just work slow and your body will tell you what's good and what's bad. Here I'm again gently rolling out to the side. Focus on your breathing. Take your time. There's no rush here. What we're looking for is an outcome. We're looking to decrease tension. So there's no timer on that. However long it takes, it takes. Try to listen to see whether you should keep moving through something or listening and slowing down and spending some time in an area. Usually when I come into the first kind of sensations of tension, some sharpness, I'll slow down a little bit more, maybe stop. And as well, you can check range of motion here, moving this arm. That'll change the orientation of the muscular fibers you're working on. And you might feel like it's a little bit more purposeful to have the orientation of fibers in one way or another. Again, here I'm just getting into the front of shoulders, into delt, and into biceps tendon as it crosses the shoulder. Taking my time, and then I'm just going to gently work down my arm here as I move myself up. You can rest your head on the floor, or on your hand, or on a yoga block. As well, you could block up your opposite shoulder if you felt like you needed to. And don't be afraid to grab a pillow or something. If you're feeling this in your low back, you might be extended in the low back. You can just throw a pillow underneath your abdomen to support yourself. You're in your home. Do what you need to do for you. Again, focusing on breathing, focusing my mind into the area. If you are doing some movement, make sure it's slow and thoughtful so that you can stop if you feel like you need to without just blowing through areas of tension. If you think about going to see a massage therapist, you'll go for an hour-long treatment. You know, spend an hour working on your own body. I spend roughly about an hour, sometimes less, almost every night rolling. It's a great way to check in with the body, see where you're holding tension. That can give you a lot of information. Where you're holding tension can tell you how you're moving, where you're putting your weight into. Now here I'm just getting right into bicep and working down the arm here. We could do some extension of that elbow. That's lengthening biceps. Breathing. And then when you're ready, let's come back up to kneeling and check things out. Okay, so let's shake things out, move the shoulder around. How are things feeling? You can check some range of motion here to see if you're having restrictions or discomfort with certain ranges of motion before. Let's say we're working with me now from an injury, or just discomfort that you're having from your job or your sport or whatever it is. Check those ranges of motion now where you're noticing it more. If you feel like you need to work more in that area, go back down now, pause it here, and check in with those areas a little bit, and then come back to us here. Now, we're gonna get into the posterior aspect of our shoulder, or just behind on the shoulder blade. This is where we're going to be working with teres minor, teres major, lats, infraspinatus, and we're going to be working into triceps here. So let's hop down on the opposite side and we'll get into that back side of the shoulder. All right. Got our tool with us. We want this just below or inferior to our shoulder joint. Here, this is going to get us into lats to start things off as they kind of wrap around our ribs and up into our humerus. We're right on our side, keeping our shoulders perpendicular to the ground. Get yourself a base of support here. And here, I'm just gently kind of rolling myself down, pulling myself with my foot and moving myself with my hands, lifting my hips super gently to get a little bit more range of motion, a little bit more movement. Taking your time. Lats is going to lengthen as we reach overhead in this direction. So feel free to just gently reach your arm on the ground, pulling your elbow then back towards you, checking some rotation. See how that feels. Working slow with those movements so that you can stop at any time. Here we can start kind of feeling the ball or the roller come up into our shoulder blade, into our scapula. We just want to ride that line on the edge of the scapula, where we'll be working through teres major and then teres minor, and then we'll get into supraspinatus. So just inching yourself down very gently, taking your time. Focus on your breathing. Trying to stay relaxed. You can let your head drop here if you want. Just let it hang into your shoulder, or you can support it up. Depending if you hold regular neck tension, that might be discomforting, holding it on the side like this for an extended period of time. Here, when we start getting into teres minor, teres major, infraspinatus, remember these are rotating muscles. They do rotation, but that's not their main goal with the shoulder. The main goal with the shoulder is to create stability, altogether pulling the shoulder tighter, the glenohumeral joint. So pulling the humeral head into the glenohumeral fossa so that it is stable through dynamic range of motion when you're holding something heavy. So you can test that range of motion here, and you might find that with external rotation, it might come up a little bit more, feel more purposeful. Nice and slow in those movements so that you can stop when you need to. Gently working yourself down. We'll be coming up into teres minor and infraspinatus now. Do be careful if you have past dislocations with the shoulder. Just take things nice and easy. Support yourself as you need to so that you're not compromising the shoulder in any way. And being mindful, listening to your body. Stop if you need to. And we're just using our body weight. You don't want to be pressing down into the ball. And you feel like you're done through those rotator cuff muscles, coming just across the joint here into the triceps attachment, right at the bottom of that glenohumeral fossa. At any time, skip back to the anatomy portion and check out the areas that you need to for this part of the video. With triceps now, it extends the elbow. So a little bit of flexion and extension here can be helpful. Check some rotation as well. Take your time. And when you're finished with triceps, let's come back up to our knees and check things out. Okay, let's shake things out a little bit. Move the shoulder, again, checking range of motion. If anything was discomforting before, check that range of motion, whether it's putting on your bra, arm over your shoulder, whatever that might be, your testing ground. Check that out. Go down, do some more work if you need to, and then come back here. Now, we're gonna get up against the wall and we're gonna work through all the rotator cuff muscles as they attach into the greater and lesser tubercle of the humerus. We're also gonna check in through deltoid muscle as it wraps around and over the shoulder. So let's go find ourselves a piece of wall. And here we are up against our wall. Take your tool and we're gonna just put it on the wall in between our shoulder and the wall here, gently leaning into it. What we're wanting to do is be just underneath the acromion process. So just along the collarbone until you feel that kind of drop onto another bony shelf there. That's the acromion process. And we want to drop over that. And we want to work all the way along from around the front. This is working through delt. We're working through subscapularis in the front. We're working through supraspinatus in the top and infraspinatus and teres minor in the back. So we want to work along that whole line there, all the way around to behind in the spine of the scapula, just underneath that. So here we can kind of get the ball into just kind of the front a little bit more and then work around the back, but wherever you feel like you need to work for you. You may already know, talking about the area where you need to work for you, but it's always good to check in throughout the whole shoulder. Here you can mitigate how much pressure you're putting by either stepping your feet further away to put in more pressure or standing closer to the wall, which will give you less. Here, remember, rotator cuff rotates as well as stabilizes, so you can do a little bit of rotation as you're working through here. Again, working very slow, being mindful of the area and focusing on your breathing, calming everything down. Taking your time. I'm slowly rotating my way around underneath that acromion process, the collarbone, and that spine of the scapula. We're also working through deltoid to get through those, so we'll be getting into the attachment for that as well. As you rotate a little bit more, you'll have to kind of open your chest a little bit more, bringing your back to face the wall to get into that back aspect. Again, checking with some range of motion, breathing, listening to the tissue. There are countless number of nervous system receptors in the area, so they'll be giving you a lot of feedback, especially if you need this kind of work. Again, at any time, feel free to step away from the wall and the roller if things aren't feeling good. Try not to let the ball press your shoulder up into your ear, so stabilizing your shoulder down and away from the wall, or your ear, I should say. Once you've felt like you've gotten through the whole area from the front to the back and done all the movement that you need to do, check through the meat of deltoids, so through the muscle belly, so working down into the side of the shoulder where it attaches on the humerus. We can do that by just coming down a little bit and then gently standing up slowly to roll that ball down the belly of deltoid. Here you can gently press into the wall with your elbow or do some rotation. See what feels right for you, see what you need for what's going on with your shoulder. And hopefully you're not coming from an injury and you're just doing some gentle maintenance of your body, in which case you might be a little bit more general with your work. And then when you've finished with that, let's go over to a door or a nook or a wall corner where we can get our head past the working space and we'll work on our neck. Now, we found our corner, we've got our tool, and we're gonna check in with our neck. Now, with the neck, we're gonna be working through our SCM or sternocleidomastoid, some scalenes, some upper traps, and then we're gonna kind of work around the back to levator scapula. The neck is very connected with the shoulder, so anytime I'm having shoulder issues, I always check in with the neck, just even if it's for a short time. Here, we want to try and keep a little bit of tension in our neck muscles by kind of reaching away from our shoulder. This will tighten them, kind of like a tightrope if you were to pull a string tight. And this will help from keeping the ball getting too deep into our neck. It'll also help make things a little bit more effective with our neck. So here, we're looking to hinge our hips back to maintain a neutral spine as we reach our head past our roll, and kind of locking that ball, that tool, into the neck here. Wide base of support with the feet. And just working very gently. Here I have my left hand on my knee, my front knee, my left knee, which my left foot is forward here. Just to help support myself. And just very gently and reaching my neck out and away as I start in the front and roll through the back. As I roll around the back, we'll have to hinge a little bit more. Doing some breathing. Taking your time. If you're feeling anything nervy through here, numbness, tingling, shooting, just take a second and stop, reassess things. Maybe this rolling here in this area is not right for you, or you might be using a tool that's too specific, too firm, like a lacrosse ball or something. That's why I love this orb. A great place to work if you're having headaches as well is into upper traps and neck, or if you clench your jaw. And just taking your time, rolling all the way around the top of the shoulder. Feel free to have your hand here if you want. Readjust, support it so that the ball doesn't fall off. Another good reason to have your hand supporting on your knee. And then when you're done, gently coming up, hinging, pressing those hips forward with your glutes to safely come back up to the top. Check in with some neck range of motion, check in with the shoulder again, see how that's feeling. And that's it for the mat. Let's go back to Mike in the office. Thanks for joining me for this self-care session for the shoulder. If you have any questions or comments, please leave them in the description below. If you enjoyed this video, please give it a thumbs up and feel free to share with any friends or family. Join the Virtue community by subscribing to our channel, where we'll be posting weekly videos. If you'd like to work with us in person, check out our website, which we'll have linked in the description below. See you soon.